Welcome to Medical Ward BSN 3F Group 3. This is going to be our second rotation, and of course, welcome to NCM 116 RLE, Nursing Care Management 116 RLE, Medical Surgical Nursing 2, and this is going to be your virtual clinical duty. This is Joseph Bahian Abang at your service to make your best even better. This is our second rotation, and of course, this is week 1. So we'll be here for 3 weeks, and this will be our case scenario for this week. Patient AB diagnosed with HIV/AIDS. And before that, I just would like to share this one with you. I am here for you. It's literally my life's work to help you grow. And of course, also, it is very important for us to take into consideration our learning outcomes. On completion of this case study, so the nurses will be able to first, build knowledge related to the patient's medical experience. Second, continue to develop a comprehensive assessment and monitoring skills. Third one is recommend nursing interventions based on the case presented. Fourth one is define the roles and the contributions of student nurses in the care of medical patients. Fifth is justify optimal therapy based on the current understanding of the case. So these learning outcomes will be the basis for me to evaluate also at the end of this case analysis. It is also very important for us to take into consideration our instructions with regards to all the things that you need to present, also to submit with regards to your case analysis. So all critical thinking questions presented within or after the case applies to this case study. You have to create a brief and to the point responses, and of course there has to be no flowery words. When asked to provide several answers, it must be listed in order of priority or level of significance. Base all your answers on the data that is presented and do not assume information that is not provided in the case. Please follow the format of your output, especially on its font style, font size, paper margin, and paper size. So of course, I have given you the format already, or the template. Saved it as PDF file and submit all your requirements per group on date specified as its deadline. Send all your requirements via the official email address of your clinical instructor, and of course, it is advised that you will submit all your requirements on or before the set deadline of submission. It is also important for you to remember that please kindly follow this format in saving your requirements for easier monitoring. For daily requirements, example is Abang underscore Joseph underscore week 1 day 1 underscore NCM 116 RLE. And for weekly requirements, Abang underscore Joseph underscore W1 or week 1 underscore NCM 116 RLE. So that's how you are going to save your file for also easier monitoring of those who have submitted the requirements on time or as early as possible. Let us have now your case scenario of patient AB with HIV/AIDS. Patient AB is a 33-year-old male, an Iglesia ni Cristo by faith, currently residing at Kamamanan, Cagayan de Oro City. Has a history of IV drug use, hepatitis C, and HIV. He has previously been managed in highly active antiretroviral therapy, or HAART, but has been having recurrent bouts of pneumonia in the last 6 months. He presents to the OPD of MRXUH today, complaining of weakness and fatigue, shortness of breath, and a persistent cough. He reports a 10 pounds weight loss over the last 3 weeks. He says, "I think I have pneumonia again." With these manifestations exhibited by patient AB, the physician has decided to admit him in the medical ward of the institution to manage the present signs and symptoms and to rule out the cause of the manifestation. You are the assigned student nurse to patient AB for this week. Critical thinking question. What further history questions and assessment data would you obtain at this time from patient AB? Number 2, what laboratory or diagnostic tests do you anticipate that physician will be ordering at this time? Further, upon further questioning, patient AB reports fever, chills, and night sweats for the last few days. His coughing has been non-productive. He has diffuse bronchi through his right lung and scattered bronchi on the left. A chest X-ray shows a nodular consolidation on the right side and diffuse infiltrates. The provider orders a CBC with differential and a CD4 cell count. The vital signs of patient AB shows the following: heart rate of 100 beats per minute, RR of 20 cycles per minute, blood pressure of 108/67 millimeters mercury, oxygen saturation of 90%, temperature of 101.6 degree Fahrenheit, or that's 38.67 degree Celsius. Critical thinking question: what respiratory disease has patient AB contracted? What should be the first nursing action that needs to be done with patient AB? Furthermore, the complete blood count with differential shows the following abnormal results: RBC of 3.9, HH of 8.9 over 24.3, WBC of 7,000, platelet of 104,000, CD4 is less than 10 cubic millimeter. Critical thinking question: what is going on physiologically with patient AB? How do you know that it is present? Furthermore, he started on high-dose IV antibiotics and his HAR therapy dosages are increased. He receives 2 units of POC RBC or POC red blood cells when his hemoglobin drops to 7.6 milligram per deciliter. He continues to be weak and he has fever and night sweats, treated with PO acetaminophen. He is flushed and his skin is warm. His vital signs in the morning are heart rate of 110 beats per minute, RR of 22 cycles per minute, BP of 88 over 47 millimeters mercury. You continue giving care to patient AB, making sure that he will receive the best and quality nursing care from you as his student nurse. You made sure also that when you give care to him, you are protected with personal protective equipment in order to prevent any possibilities of contracting any infection from him. You've ended your 2 days duty and you felt that you were able to deliver the best nursing care to patient AB and was able to attend to his needs accordingly. High 5 critical thinking questions review. Number 1, what further history questions and assessment data would you obtain at this time from patient AB? Number 2, what laboratory or diagnostic test do you anticipate the physician will be ordering at this time? Number 3, what respiratory disease has patient AB contracted? Number 4, what should be the first nursing action that needs to be done with patient AB? Number 5, what is going on physiologically with patient AB? How do you know that it is present? So you have to answer this one, and of course you have to submit the requirements at the end of the week. Daily requirements. So this will be the requirements that you are going to submit on a daily basis. For day 0, Sunday, that's case scenario loading. So of course, your case scenario will be posted on a Sunday basis. And day 1 is going to be Monday. Your basic requirements includes your general objective, your specific objectives, your daily plan of activities, your duty expectation for this rotation, your survey for day 1, and of course, your nurse's notes, and that's the FDAR for day 1. And also, it is very important for you to have an initial knowledge about the case that you have for this week, and that includes the knowledge about physical assessment, at the same time your pathophysiology, your diagnostic test, and of course your drug study. For day 2, Tuesday, your basic requirements includes your specific objectives, your DPA, your survey 2 for day 2, nurse's notes for day 2. You also have to submit with me your weekly evaluation and also including your reflective journal reading. You also have to include your critical thinking questions or critical thinking answers of the questions that we have presented. And also, you have to have your initial knowledge about the case, and that includes the problem lists, the nursing care plans that you are going to formulate, and of course, your discharge plan. For weekly requirements, you have to submit to me the following. That includes your introduction, so that's going to be the brief definition of the case, your nursing health history, the physical assessment, the anatomy and physiology, the pathophysiology, the diagnostic tests, the drug study, problem lists, nursing care plan, discharge plan, learning outcome, and of course your references, and that has to be in an APA style of reference taking. For the deadline of submission, you have to be keen with the deadline of submission because of course you have to make sure that your requirements are on time. For day 1, the deadline is March 1, 2021, Monday, 11:59 p.m. For day 2, deadline is March 2, 2021, Tuesday, 11:59 p.m. For week 1, the deadline is March 6, 2021, that's a Saturday, 11:59 p.m. We are all on our own journey, but in this class, we all need one another and will help one another grow. This is my details. My email is jabang@xu.edu.ph. My number 0931-042-9842, and of course my other social media accounts. This has been Joseph Bahian Abang at your service to make your best even better. To God be all the glory.